Hi, I'm Courtney. I'm your treatment coordinator for today. Now that you got your brace on, I'm going to talk you through your cleaning pack here. Okay, we'll start you off with this one here. Okay, it's your TP soft brush. Okay, the bristles are extra soft. Okay, so it's not going to damage your brace or your teeth. You can use this for the first few days, and then you can move on to a medium headed brush, which you'd find in your local shop or chemist. Okay, the next brush I want to talk you through is your travelling toothbrush. Okay, it's so handy to have. Pop off the lid there, you've got your brush at the top and you can actually twist out the bottom, okay? Take off the black cap and you can fill it up with your own toothpaste, okay? It's so handy for the likes of school or work, okay? Anytime you eat now, you're gonna have to brush your teeth, okay? So it's so handy just to pop in your bag, okay? Next brush then is your little interbrace brush. So you've got your long stick here, you've got tiny little brushes in here, and what you can do is you can take one brush out, pull up the blue lid, pop a brush into the little white circle there at the top and just push the blue lid down, and that locks the brush in place. And what this brush does is it cleans under the brace, okay? So up under the wire, all around the edges of the brackets, and it can actually act like a little floss, so it can get right in between the teeth as well, okay? So you've got 10 brushes in there, and you've got a refill pack, another 10 there. So that will last you for a good while. You don't have to throw away the brush every time you use it. You can reuse it. Okay, when you change over, okay, you'll see the little bristles starting to die down. That's when you know to change. Okay, next brush here is your 2-in-1. Okay, you've got your little medium brush there at the top, and you've got your little interbrace brush there at the bottom. So it's so handy to have in the bathroom. Okay, the next brushes here I'm going to talk you through are your little travelling ones. Okay, they're little interdental brushes that you can pop in your school bag or your handbag. They're really handy, okay? As I said to you about foods that will get caught under the teeth, okay? It's so handy to have these in your pencil case or your handbag, and you can just take them out and use them, okay? The next thing I want to talk you through is your wax, okay? So you've got little strips of wax here, okay? What can happen when you get the brace on, when you're talking, your lips can actually go up and down off the brace, and it can be a little bit sore, and sometimes the wire can poke out the back into the cheek and it can cause blisters. What I want you to do, if you find it sore, break some of your wax off, roll it into a ball, soften it up, and then I want you to mold the wax over the bracket if it's uncomfortable, or put it at the back of the wire, and that will act like a little cushion there on the lip. Okay. The next thing I wanted to talk you through are these little disclosing tablets. So they're really handy to have, and what they do is, if there's plaque on the teeth, they'll stain plaque like a bright pink colour, and it will help you with your brushing. Okay, you've got a little timer there for yourself for brushing your teeth, so 3 to 4 minutes altogether now with the brace on. Okay, you've got a little pocket mirror, it's really handy to pop into your handbag. Okay, and then your squirrel mouthwash. So you can use any mouthwash throughout the treatment, okay, just to make sure that it contains fluoride, okay, because that just strengthens the enamel. And then you've got the food chart here that I want to show you, okay. It's just that we advise patients not to eat because it can damage the brace, okay. So as you can see from the photos, it is the likes of all your hard foods to stay away from, okay. So anything that requires force in the brace can actually pop the brackets off, okay. There is 3 pages there, you can have a read of it. If anything ever happens to the brace, make sure to call us and we'll get you seen to sooner than your scheduled appointment. Thanks a million, bye bye.